yourself, we're finding big numbers that companies, small, medium, large, are losing.
Right.
And that's why we call it the human bleed. The bottom line is suffering.
Yeah.
And we're going to take you through journeys, through different stories and different clients, and be able to really show you we're focusing on the wrong things here
Right.
with companies, with business. It's not the economy, it's the human bleed.
That's right. That's right.
She saves lives. She can't save her marriage.
Mm.
We're going to be, yeah. She lost 3 patients in 1 week, 2 colleagues to resignation, and her husband stopped asking how she was. Nobody at the hospital noticed any of it.
Wow. Yeah, we're talking about Rachel. She's 44, a charge nurse in the ICU, the intensive care unit, Tulsa. And she's managed critical care for 18 years. I mean, this woman is not new at the job. She's absolutely excellent, accolades all the way from the top down, all the time. She really is just the center heartbeat of that entire unit, really. But she also is carrying the weight of 3 patient deaths in 8 days. And then in the the wake of that, 2 of her nurses resigned. Not just any nurses that she brought into the system, that she trained. And then on top of that, a marriage that has gone functionally silent. So Dale, her husband, according to Rachel, stopped asking her how her days were going, like every day. Hey, how's your day? How's your day? How's your day? About a year ago, because the answers were too heavy. I mean, who wants to come home and hear, well, I lost 2 patients and I lost 3 patients, and he didn't know what to do with the heaviness. So he just stopped asking,
Yeah. And what's funny about that is I talk about that a lot in my work, right? The day-to-day with your job, nobody cares.
Right.
Right. But there's a side of this where it is very heavy. That's a big burden that she's carrying with the 3 loss.
That's right.
The 3 losses, right? But see, that's the moment that the marriage starts to fracture, right? And with the weight of the job becoming unspeakable inside the home, right? It's not that Dale, her husband, doesn't care.
That's right.
It's he runs out of the capacity to actually handle it. That's right.
Yeah.
Rachel's bringing home all of this baggage, okay, and she's having to manage all the crisis and her own grief at the same time.
That's right.
Right. Eventually, she can't handle it anymore.
That's right.
Right.
Yeah. And she runs on a code too. What's the code of the leader? Efficiency, silently, alone. That narrative that goes on in the mind, and really we don't even know it's there. And we see that all the time. And we talk about, Cass, a ton. People say, well, my spouse just doesn't care. No, it's usually capacity. We could take this whole show and talk about capacity, but that's not the point of it, right? But see, here in this situation, what a lot of people don't realize is that 1 in 4 employees is grieving at any moment about something. And in the healthcare industry, that number is significantly higher. Why? Because grief is ambient. It's the professional environment. It's what they do. Nurses and physicians are losing patients regularly, and they're expected to perform and be chipper and have a good bedside manner at full capacity, not just days later or weeks later, in the same shift. So you may lose a person and then have to walk out of that room and go into the next room and just, hey, everything's great, everything's good. So the bereavement leave policy in the United States is usually what we talked about this a lot, 3 to 5 days for personal loss, But professional loss, the death of patients that they fought for, there is no policy whatsoever. There's nothing.
Isn't that great? That's crazy. Right. Just put it into perspective, right? The moment that the death occurs on a shift, she's got to perform and be happy, be ready, be excited, be able to focus on the next patient.
That's right.
Right. And Rachel's never been given permission to grieve professionally.
No.
She has to absorb it.
Yeah.
Internalize it. And so she gets quieter at home, shorter with the kids, more isolated from her husband.
That's right.
The hospital sees a charge nurse who's still performing, still on time, still managing her floor. They don't see what that performance is costing her or what it's costing the people at home waiting for a version of her that stopped showing up a long time ago.
That's right. That's right. And there's a significant cost there, Cass. What the typical cost in the context of healthcare? What's the annual grief-related loss to that?
We got $225 billion a year. Grief-related productivity loss to U.S. employees, 30 workdays of unscheduled absences annually for bereaved employees.
Right.
Healthcare worker burnout costs, the hospital $9 billion a year in turnover alone,
Oh,
like
wow.
those nurses that quit that she
Yeah.
personally trained.
Right.
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 55% of the nurses report burnt out symptoms, grief, and a moral injury that are the primary drivers.
Right.
That's from the Grief Recovery Institute, NSI Nursing Solutions 2024.
Wow. Good golly. So, and this just the icing on the cake. And see, one of the things that we do when we come into companies that we help them see that there's a compounding reality here. It's not just I lost a patient, now I've got to carry this home. Now the marriage is in trouble. What's happening with the kids? What's going on in my own mind? So I'm not sleeping. I'm not this. I'm not that. I'm not the other.
Mm-hmm.
And I mean, really, the sleep is the first casualty. I mean, we were just talking about that this morning on our personal conversation. Sleep is the first casualty when we're stressed out or when things just aren't working the way that we want them to do. I mean, sleep is an obvious loss. So Rachel is not sleeping. She gets up at 2 a.m. and she runs on the last hour of her last critical patient. And what is that clinical term? It's called intrusive recall. It's the same neurological mechanism as PTSD. And so the Rand Institute estimates that sleep-deprived healthcare workers cost the system over $1,967 per worker annually just in fatigue-related productivity loss. And that's before a medication error. That's before a missed assessment. That's before oversleeping. That's before anything or a patient safety event that changes what? Everything. Because then you've got a malpractice issue on top of it.
That's right. And then this goes deeper. We're talking about the hospital, but the costs at home, I mean, they're just cohabiting. They're just roommates.
That's right.
They're cohabiting around their kids. Mia, 15, Connor, 11, right? Performing the functions of a family without the emotional connective tissue that makes it one.
That's right.
Okay. Research on couples in high stress medication professions shows divorce rates 20 to 30% higher.
Wow.
Than the general population. It's not happening because Rachel and Dale stopped loving each other. It's happening because grief with no exit fills every available space.
That's right. And the hard thing about it, Cass, is that they don't know. They see everything melting and burning around them, and they probably bought some books or took some courses or what have you, and they're trying to fix the spark or whatever. But you can't dig a hole to plant a tree when you're too tired to hold the shovel. And so we've talked about like sleep and marriage, and then what's another thing that happens here in this situation? Financial pressure. I mean, it builds underneath. Healthcare systems are chronically understaffed. Rachel is regularly absorbing mandatory overtime. She's having to work doubles twice a week sometimes. What happens when mom and dad are both working? You got childcare. Childcare isn't, very well, childcare is not cheap. So then we got schedule disruption. Well, we got this, that, and the other. Well, we can't because I got to do all this, and then the household begins to run on the financial edge of what Dale's income and Rachel's base can sustain. So the overtime premium doesn't cover the cost of what the overtime costs and takes from them.
100%, and it's going to filter back to Mia and Connor, right? I mean, Mia knows her mom is struggling. She's not okay. Right. She's managing Connor, managing her own reactions, reading the room before she walks in. A 15-year-old girl has learned to parent her parent. It's not just that's a sad observation.
It is.
That's all too common.
That's right.
Right.
That's right.
It's actually a clinical risk factor for anxiety, parentification, relational patterns that will follow the children into their own adulthood.
Right. Yeah. Parentification is a serious thing that where the child takes the role of the parent and the responsibility of the parent, not because the parents are deadbeats, because typically they're working multi houred shifts and they're trying to manage everything there. And then, look at everything else that's going on. Now, one thing that Rachel doesn't openly talk about, but it's something that she talked about in the context of this interview, is that she's 44. The hormonal picture is compounding as well. She's in perimenopause, and it's something that actually exacerbates everything. Just like with men, when we get to a place where our testosterone starts dropping, it starts to create fatigue and moodiness and everything of that nature. And so sustained grief elevates cortisol and suppresses estrogen. So the brain fog that she's been attributing to being tired is also biochemical. And this irritability that she's been calling stress could also be related to hormones. And so these are two separate systems failing at the exact same time. And the company that she works for, this hospital, has no language for either of them. And they just don't know. And one day, what's going to happen is they're going to say, Rachel, we have to have a hard conversation.
Hmm. And don't forget that the numbing pathway is open,
Oh, yeah.
right? Nurses and physicians are among the highest rates of prescription medication misuse.
Yes, that's right.
In any professional group.
Yeah.
Right? Not because they have easier access, although they do.
Yeah.
But because the pain is relentless and the culture offers no legitimate outlet for it.
That's right.
Right? One person caring this much, sleeping this little, with a marriage this silent, is a person who needs somewhere to let go of the pain.
That's right. And the hospital's investment in Rachel's 18 years of expertise, her institutional knowledge, her relationships with the floor staff. I mean, you think about what it takes. I mean, we've had staff, in the projects we've been working with over the last few years, and it's hard to find someone who will walk with you. And when you've got somebody walking with you for years, and then all of a sudden they are on the brink of falling off the cliff, you're like, what? It's gonna become an avalanche. So our data shows the average cost to replace a person like this is $52,000 to $88,000, because Rachel is not a position. She's literally an ecosystem. She's literally a culture. And right now that ecosystem is failing silently behind a performance record that looks very, very clean to this point. So what do we propose? Well, what we do as the Human Bleed Project is we come in and we help everybody understand the compounding nature of these bleeds. And we not just provide, but we install a surgical response. Hospitals implementing structured and grief support and peer processing programs can see a 34% reduction in nurse turnover within a 12-month period. And every 1% reduction in turnover at a 340-person health system, that's $300,000 in savings a year. Now, this is just a support and peer processing program. It doesn't even talk about what we do in the sense of actually holistically and having an integrated opportunity to see things transition and transform. So the surgery here is not a wellness app. It's giving Rachel a language and an understanding for what she's carrying, not just professionally, but also at home. And this is going to be important before Dale stops being someone she comes to.
I say it all the time. Relationship is the foundation.
That's right. That's right.
All right, guys. This has been another episode of The Human Bleed. Let's do another.
All right.
See ya.
See ya.
The numbers don't lie. He does. He's managing an 18 million logistics operation while his personal finances are in free fall. And the only person who doesn't know is his wife.
Okay.
James, tell us about Marcus.
Yep. Marcus, Regional Operations Director at a mid-sized distribution company in Memphis, Tennessee. He oversees $18 million in annual logistics operations a year, and he's 45 years old. Okay, now this guy, Marcus, is very precise. He's a bean counter. He's high-level functioning. This is the framework. This is the structure. He's detail-oriented, and he's trusted completely by the higher-ups in his company. They don't even check up on him. If Marcus gets it, it's done. He's also 3 months behind on his second mortgage, okay? And I just said second mortgage, carrying $61,000 in personal debt from a failed real estate investment that, that happens. But here's the point. Yvonne, his wife, doesn't know about the second mortgage or the failed real estate investment. And he's been managing both sets of books. Now, we've had, a couple of episodes ago, we had this I think it was a finance broker, had the same thing. He didn't want to talk about debt. This is one of the human bleeds, this financial pressure. And a lot of time it falls around debt. So he's been managing two sets of books, his company's and his own simultaneously. And one of them is accurate. Which one? The company. The home books are not.
Well, and they're not. The weight of the financial secret, I call it financial betrayal, as you know.
Yes.
The financial betrayal in the marriage doesn't just affect the person that carries the burden, the stress of knowing the money, right?
Right.
Like Yvonne knows something is wrong. Like I always say, wives know their husbands better than they know themselves.
That's right.
Right. But she doesn't know what, right? She's been chalking it all up to work stress, to Marcus being Marcus, driven, distracted, hard to reach. But the distance that she's feeling isn't personally. It's isn't personality matter, right? It's a man under surveillance 24 hours a day by his own conscience.
Yeah. Yeah.
Oh God.
He's in a courtroom 24 hours a day, even when he goes to sleep and when he wakes up, he is indicting himself every moment. How can I get out of this before it becomes something that's going to destroy me? And financial stress is the number one stress for American employees. I mean, ahead of work, health, and family. I mean, it doesn't discriminate by income either. We talk about this statistic constantly that among employees earning six figures or more, 52% of them report feeling financially stressed. Why? Well, everybody well, you should have made better choices. True, but you didn't. And sometimes you can't help but make the choices you make. Marcus earns approximately $94,000 in salary plus benefits. His company trusts him with $18 million a year. He's hiding $61,000 from his wife. The asymmetry of that math is not lost on him, okay? It is eating him alive every single second of his life.
And here's what I see in the couples that I work with who are carrying financial secrets, okay? The intimacy goes first.
Yes.
Not because anyone made a decision to withdraw,
right,
but because genuine closeness requires lowering your guard. A man keeping a secret this size can't lower his guard.
No.
Right? Every moment of real connection with his wife is a threat.
Yeah.
Right? And we always talk about this. By the way, we're not talking about just sex.
Right.
We're talking about intimacy.
Connect.
You can't be intimate and connect on any level, including conversational, if you're on guard, hiding.
That's right.
Betraying. Right? She might ask the wrong questions. She doesn't mean to. She's trying to figure it out.
Yeah.
Right? But there's such a disconnect. There's such a distance. It keeps the conversations all surface level. And we talked about earlier the day-to-day. We need to be more than the day-to-day when we have conversations. We can't even get past the day-to-day here.
Yes.
Right?
That's right. Oh, gosh. Something else. What is the cost there?
Best employees are 76% more likely to have a negative impact on workplace morale. Financial secrets present in 1 in 3 households is the leading predictor of relationship breakdown.
Wow.
Like I said, I see it all the time, right? That's according to Bright Plan 2024 and the NEFE in 2022.
That's right. And just like all of these, the compound happens. And this is one of the things that we do with precision. We come in surgically and help people see this is not just one area of loss, one area of reduced life, one area of reduced profitability for the corporations and their organizations, but it's compounding. So the financial shame runs the operation, the other systems going down with it in the same time. So for example, I mean, here we go. He's not sleeping. He personally reports he's not sleeping. Why? Because 56% of financially stressed employees spend 3 or more hours a week at home managing their personal finances. But Marcus isn't doing it at work. He's doing it at 3 o'clock in the morning. What is he doing? Running scenarios, calculating margins, calculating how much longer he can hold the line before something forces it open. And his sleep debt at this point is months deep. And running on an $18 million logistical operation on that sleep load is making decisions with a brain that is clinically impaired to the point of inebriation. I mean, I was just telling you how this weekend I was like, threw my keys in the trash, tried to crank the car with the medicine bottle. I mean, it just being a little tired. Imagine the stress there. And what's his marriage?
Well, and I just like to add to that, like being impaired at work legally, right? Essentially. Okay. He's also that same level of functionality at home with his wife.
That's right.
Right. So the marriage starts to come to a tipping point. Couples with high financial conflict are 30% more likely to divorce within 5 years.
That's right.
5. And that's with disclosed conflict.
Right.
Betrayal-based or secret-based conflict has no healthy outlet at all.
That's right.
Right? Which means it doesn't disperse through the argument or resolution. It accumulates. So his wife, Yvonne, is going to be, like her instinct is that something's wrong, is accurate.
Yeah.
Right? But when she finds out, not if, when, right? You can't keep a secret like this forever.
That's right.
The violation won't be the debt. It will be the deception.
Yes.
Right? We see that all the time with our dudes,
Yes.
right? The wife finds out about the money he's been spending or whatever's going on. It's actually not about the fucking money.
No.
It's about the betrayal.
That's right.
Right? Financial infidelity causes relationship damage comparable to sexual infidelity in 76% of cases.
Yes, it does. And then, look at this guy. I mean, his physical health is starting to fail. Chronic cortisol elevation, sustained financial stress is linked to high blood pressure, to cardiovascular disease, to immune dysfunction. He probably feels fatigued. He gets colds every time his kids come home sick. And he hasn't had a physical in 2 years because a doctor might ask questions he doesn't want to answer honestly. When you go to the doctor and say, hey, is everything good at home? How you feel on a scale from 1 to 5? Are you happy or are you not so happy? And the reality is the company's operational risk and Marcus's personal health risk are converging on the same timeline.
What's crazy, when we think about how these the bleeds compound and compound, we're going to go back to the children again, right? The shortness that they feel from their parents, right? The emotional temperature. The kids are like little sponges, right?
Yes.
And they're absorbing all of this. All of it. It's number one emotion running through this home is going to be a high level of anxiety.
Right.
Children are absorbing the ambient anxiety as if it's their own.
That's right. And then, of course, we could talk about addiction risk. It's absolutely very common for alcohol and substance abuse disorders to be prevalent here because they're consistently highest in populations experiencing sustained financial stress and shame. Marcus is not there, thankfully, but a man with no healthy outlet, no way of really getting out there to relieve this pressure in honesty, which is the point, is isolated by a secret he can't share, running on broken sleep. This man is one season away from finding something that quiets the noise faster than a resolution.
Yeah, and let's not forget shame he's feeling about this debt, this burden, right? Wondering how he got here over and over and over again. Right. Why did I make these decisions the way that I made them? Yeah. He's grieving a version of him that's not in control.
That's right.
Even know how to rebuild relationship with his wife. He's worried about what happens if he starts making bad decisions, poor decisions at work. He's constantly trying to put himself in a place where he knows where he's going. But that grief is a whole nother level. How many men, James, just think about this. How many men do you think that we work with that don't know who they are?
All of them.
All of them. I knew you'd say that.
All of them.
Yeah.
There's not
all of them
that I've ever met.
Yeah.
And I've got a lot of answers, brother. I mean, right now, as it stands for the last 2 years of us working together here, I mean, I've probably asked that question to 4,000 people. And 4,000 people, even half of them who said, oh, yeah, here's the answer. The answer is not true. It's not true.
It's just it's a description of something that they want to be.
That's right.
Right. So the surgery here, we have to get into some financial wellness program, right? $1,551 for every $100 invested. That's what we can talk about. Structured financial disclosure support, helping employees like Marcus, surface the truth in a safe framework.
Yes.
Right. Because remember, she's going to be mad about the betrayal.
And
he needs to feel safe too. Right.
Yes.
Whether or not he made a mistake. This is, where you come into framework. Right. That's going to reduce cortisol markers, improving sleep quality, restoring marital trust. Right. Within 60, 90 days in documented cases. Trans cores total bleed across all 7 categories, approximately $3.8 million
wow.
per year. 20% improvement saves $760K annually. Yep. The conversation Yvonne hasn't been allowed to have is the one that starts the recovery.
Yep. And this is not something that the company's programs can do. And I know we talk a lot about these things, but what you need to focus on right there is that 20% improvement on all 7 categories. What is the total approximate loss? The bleed is $3.8 million for TransCore. That's this company. Okay. This company is bleeding $3.8 million right now. We've calculated. Now, the reality is a 20% improvement gives them back $760,000 a year. What happens when the conversation with Yvonne happens and then everything starts to live again, to breathe again, to know who they are again. So what we're proposing is not coming in and creating more programs. What we're proposing is an absolute proven method of integrating life architecture from the root up, from the top down, and everybody. So that's
well, and
there.
just, this is a really good way to highlight. We always talk about women needing to feel safe, right?
Yeah.
When we understand that someone is quote unquote in trouble for the lie, not just the money issue, right? The money's the symptoms, the betrayal is the connection issue, right? We know that if we help them, then what happens is it's a safe place for him to talk. They can build their trust again, and all of the compounds will compound, and you make way more money than that 760K annually, because we're just talking about one small thing, not the compound's total cost.
That's right.
Right?
That's right.
So, all right. Well, thank you. It's been another episode